Start working around the iliac crest, and we start getting some activation in that area as well. This is very, very effective to reducing spasm. So as far as when you start going into the larger muscle groups, you can back this out closer to the 50 pounds per square inch, of course depending upon the patient. If you have a smaller patient, you might not go as strong. If you have a larger construction worker type patient, you might need to open it all the way up starting in the thoracic spine. It just matters on the individual, of course. So we've covered the lumbar spine. Let's go ahead and look at the pelvic area. A lot of times when we get the sciatica and or reticulating pain that's coming from muscle spasm in the lumbar spine, another muscle group, which is the other back muscles, are the gluteals. Gluteals, piriformis, and when we start working these areas, you need to be very confident with the patient. You need to be very careful with the patient explaining what you're doing. If you just start applying an instrument to the gluteal areas, you know the number one lawsuit for chiropractors is obviously sexual harassment, so you need to make sure that you're explaining to the patient. You always stay away from the great divide. We're working muscle groups here. We don't want to violate the patient. We don't want the patient to feel uncomfortable. So it's very important when we start explaining to the patient what we're going to do that we palpate first. So what I do is I come in, I explain to the patient that we're going to be going in palpating the gluteal muscles, the butt muscles, to find out which ones are pulling tight on the nerve that's causing the pain. And when we do that, we can find exactly where the tightness is concerned. As far as the patient is concerned, we mark it with our hands and we don't pull and poke. But we come in, we find exactly where it is, and then we can open up the hands and give some nice easy impulses as far as where we're finding the tight muscle fibers. The web of the gluteals as well as the web of the piriformis are all interlocking to each other. If you're able to loosen those up, you can many times loosen up the stranglehold that it has on the sciatic nerve. You also have to clinically differentiate whether or not this is a lumbar radiculopathy, but you can still work the same muscle groups when that occurs by trying to isolate exactly where the source of that nerve pain is. Is it starting at the sciatic notch and working our way down? Well, then obviously we're talking about sciatica. If we're starting up here towards the sacroiliac joint, or we're talking about the L5-S1 junction, well, then we might be talking about a lumbar radiculopathy. So you have to be, as the doctor, the clinical diagnosis, you have to be able to isolate this a bit better to be able to be that much more effective. But with this device, if it's a lumbar herniation, you're not going to further herniate a disc by giving it some light tapping. A lot of times you can reduce their pain, therefore predict that the less pain that they're going to have, the less chances for surgery that they'll have. So it's worth the try as far as being able to help affect the body. So there's our lumbopelvic region, and we're going to go ahead and continue to move on further down the body as far as the extremities are concerned.